that it has been quite an interesting learning session. Because even actually when I came on board for this meeting, I didn't have a specific, like who are these guys I'm facing. But as the time has gone by, I've come to realize that we have quite diverse, IT specialists who are working to the common cause of improving health, but from different approaches. And I wanted to bring it to your perspective that the Ministry of Health is quite broad, not as maybe as you may see it. Because from the top organogram up to the bottom, of which we have those various levels, from the ministerial level up to the community level, it is quite they are quite different ball games from the different levels, but all working towards a common agenda. Maybe as she mentioned, nationally we have the DHIS, which is used basically as a data, from the centers all the way from the community to the national level, collecting the data sets from, which are used to report. But, you guys, as I understood as you are talking, I realized you have other ideas, very good ideas, if I may say, which are all going towards, improving the health of the patients and, all those factors in mind. But as you have said and you have heard you discussing, it will be of paramount importance if you organize yourself in a way. You say that, for example, total health, these guys are working on this particular, department or level. If it's maybe the community, they structure a way on how they can work better, or if these others are working from this way. And again, when we talk about health, you cannot approach the public sector health the same way with the private sector health. Those are also two different ballgames. Because you will find that in the private sector, they may have other sophisticated, systems and machinery they're working with, which are different from the government, even at KNH and even coming to this county and local health centers, they're different. For example, I'm imagining a scenario. You go to a health center whereby even the access of that computer is quite a challenge. And even the health professionals who are there, they may not be computer literate, So it may be a bit challenging. And again, you start telling that person to, use that platform or app to, reach a certain patient somewhere. That will be adding stress on top of stress to that medical professional at that particular time. But because you have very good ideas, which I think they have worked somewhere, as you mentioned, talk of the US and the medicine and the rest, they can also work in Kenya. But, you must approach it in the context of a Kenyan way. How is it? What is workable in Kenya? It may not be workable in another place. Talk of Malawi, talk of Mozambique. But, you have to engage these guys, but in an organized way. So my closing remarks were, all the ideas you are having are of significant value, but let them be in an organized way, whereby we know that this particular group is targeting this particular, clientele or particular hospital or level of health, and this particular group is targeting this, so that you not duplicate again your activities, the way you are saying, bombarding doctors, so that it is in an organized manner. And with that, because we usually say, if you want to go to walk, if you want to go far, you walk alone. If you want to go fast, you walk alone. But if you want to go far, you walk together as a group. And I'm sure if you bring your heads together, because they are brilliant, I have to say that, and have an organized system, whereby, for instance, you are talking something, your friend is not agreeing with you, that shows again there's a gap somewhere from this side. So, approaching the Ministry of Health with that gap, it won't work, let me assure you. That's why you will find, for example, my friend was saying, because of those bureaucrats, because they will be like, this partner comes in. For us at the Ministry, we call all of these guys like partners or stakeholders, because they come to strengthen or to improve the Ministry of Health or the health sector as a whole. So that means if you come in to strengthen, you have to come in a way that will be assimilated to the organization, the working of that particular organizational level or ministry at that point. So basically, let me finish by saying that they are good ideas, but let them be organized in a way that they will be easier to enter or to venture in that health grounds. Thank you.